evening. It's live. It's happening. Everything's working, I assume. That's a fair assumption to make. And not only are we live on Facebook and also YouTube, but this social media influencer right here is about to go live in any second on the gram. That's right. He is one of Instagram's I won't say top, but he's one of Instagram's live users. I think that's all we can say. Hand on heart, I don't think we can really say that he's a top one, because I'm sure there are people who have got more followers on the gram and indeed Facebook. But what this is all about is quality, not quantity. That's what I tell myself. Okay, so it's all about quality, and there is certainly quite a lot of quality about to come up with some of the questions that I have been asked in the last week. If you have a question that you would like answered, and particularly if it is related to plastic surgery, I'm your man. Jackie is in the house. Power use, I would say. Jackie is probably holding up the Instagram account single-handedly. Thank you, Jackie. And I'm going to go in with this one here. I wanted to ask you if it is possible in your clinic to remove the bags under the eyes. They're very prominent, and I would like to get rid of them because they look very unsightly. Yeah. So basically, in terms of eyes, you've got upper and lower eyelids, which we can operate on and take the excess skin away from. And the upper eyelids is a relatively simple procedure. There's always stuff that can happen, but it's a relatively simple procedure to remove the skin of the upper eyelids. The lower eyelids, the so-called bags under your eyes, is a little bit more difficult procedure. It's slightly more involved, and it is more likely to require a general anesthetic. And therefore we don't do it at the clinic, because we don't do general anesthetic at the clinic. We only do local anesthetic at the clinic. We do general anesthetic, but we normally, well, not normally, always have to go to a hospital to do general anesthetic, and that it puts an extra level of complexity on things, and costs and price, etc., etc. So I'll give you full disclosure here. We don't really do much in the way of faces. I don't do faces personally. But we do have surgeons at the clinic who do faces, but the thrust of the clinic is breast and body. Most of the work we do is breast and body. As I say, upper lid blepharoplasties is one thing. Lower lids is a bit more of a big deal. And do you know what? I should probably know. The answer is you call the clinic, they'll know, and they'll know what the guys are doing and where they're doing it. This is bad. The first question. Fortunately, no one's on. Hardly anyone's on. Jackie, a couple of, it's all right. It's all right, Jackie, isn't it? You're used to this. You're used to this shambolic answering the questions. What I should do is read the questions before I start, shouldn't I? Let's be honest with ourselves. If you were going to tell me how to do this, if you were mentoring me, you'd say, read the questions, mate, before you start. So you know what you're going to say. Don't just go in there and put the question up live on TV, because that's a recipe for disaster, because stuff like this happens. They ask you relatively simple questions and you don't really know what you're about. So yeah, well, I do know, because the question says, is it possible to remove the bags on the eyes of the clinic? Well, no, it's not, but it is possible under GA, and I don't know what the guys are up to in those terms. A bit more difficult. Right, move on, guys. Move on. Let's move on, because I was wondering if you did forehead reduction surgery at all, not a hair transplant. Yeah, no, I get you. And I actually had a patient the other day ask me about this, actually live in the clinic, and the answer is no. We don't. I mean, I would say even that's even a niche of facial plastic surgery. So I don't do facial plastic surgery in terms of nose rhinoplasty, facelifts, brow lifts, those sorts of things. So I don't do those. That's a sort of separate specialty within plastic surgery. I just do breast and body contouring, and then I was about to say fairy dust there because fairy dust came up. And then hair transplant is like a niche of itself. And I understand that if you're saying forehead reduction, not hair transplant. I get that, but what will we say? Hair restoration surgeon, or I don't know what you call it, but that is a niche in itself. The one that I know is Greg Williams. He is a plastic surgeon who seems to have made a name for himself within the hair restoration space, shall we say. So he would be my recommendation. I don't do forehead reduction, so I think it's basically bringing the hairline down. So I can't really give much comment on that, but Greg Williams would be my recommendation in those terms. By the way, I've got a new feature on Facebook. I think it's Facebook. Is it Facebook or YouTube? I think it's Facebook, where I've got a little snake that goes around the screen, and every time someone gives a comment, I think it gets bigger. I don't know. I think that's what it said when I clicked on it. I don't know because no one's commented, but just so you know that the snake gets bigger, so we get a big long snake when we have all the comments together. I'm just looking at myself in the camera, and I'm seeing stains on my shirt. I didn't know that was like that. I would have put a clean shirt on if I'd known. Oh my god, is that? That's pen, isn't it? That's pen marks. That's not going to come out. What on earth has gone on with this top? How'd you get pen marks? Would I have done that? I mean, oh my god. All right, anyone got? There you go. Sue's put a comment. What's happened? Did the snake something out to the snake? Sue's put a comment just to move the snake. I don't think it's moved the snake, Sue, because I think the snake starts with 3 dots, but you've got your little picture in one of the dots there, Sue. Thanks for that, Sue. That's good. That was well worth it, wasn't it? Yeah. So if anyone knows how to remove pen marks, I've just realised by being live on camera that I've got a pen all over my top. But anyway, let's move on. Let's keep it professional because goodness knows we need some help here. What have we got? I'll tell you what we got. How long do you need to walk hunched over for a tummy tuck? Common question, this one. The answer is it kind of is up to you. We or I don't tell you to walk hunched over when you have a tummy tuck. So you walk hunched over because it is so tight, because you have to make it really tight because it always gives. And so you naturally will walk over hunched over to take the tension off the wound. And so over time that tension does that feeling of tightness does relax and you're able to walk straighter. But it's very different with different people. It depends on how tight your skin is. So sometimes people have tighter, have an increased skin elasticity than others. And it just depends on how your skin, how everything relaxes and reacts. Normally people come for a consultation or for a dressing at 1 week and you're still bent over at 1 week. I think 2 weeks is kind of normal, just talking to people. I think 2 weeks is normal for to walk hunched over. So the answer is 2 weeks. The answer to that question is 2 weeks normally, but sometimes people are feeling pretty good at a week. Sometimes people are still feeling a bit uncomfortable at 3 weeks. So it is not a set in stone for when it is. Thanks for the comments, Sue. That's the only one we've got. So we've got one little picture from the snake, but that's okay. How many comments do we need? Well, at least 3 to fill in the little pictures. But anyway, I'm not going to let it affect me. I'm going to just still carry on as if I've got a big long snake. And clearly I haven't. But anyway, that's okay. When you're a pro, they teach you that, you know, just show must go on. So is Spanx a good replacement for a binder? Yes, it is. And this is another thing which is quite personal in terms of a post-operative advice for people. So I would take anything you read or see here with a pinch of salt if I am not your surgeon. So my advice is always listen to your surgeon, do what your surgeon advises you, and go with their post-op regime, because we're all a little bit different and we've all got little bits of viewpoints about stuff and how we do things. And in my practice, I call a binder a support garment rather than a compression garment. Some people use the word compression and like want sort of moving tight things. I always say it's a support binder. So it's to give you support, it's to help with swelling, it's to make it more comfortable. We don't want it so it's really tight. We don't want it so it's compressing. It's not kind of pushing. It's not like you take it off and think, oh my goodness me, I can breathe now. So it's got to be supportive rather than compressive. So I would say that it's something that's comfortable for you. And things like Spanx or those big pants that hold your tummy in can be more comfortable than the binder sometimes. Sometimes the binder isn't very comfortable. And so if you find something that's more comfortable, and Spanx may be a good option, then that is fine. If it's comfortable, then it's right. So that is my advice to you on that one, is to use what's comfortable. And we often advise people to look for alternatives if the binder we give them is not comfortable. So it's not like written in stone. You have to use the binder, use what's comfortable. And Spanx may be a good option as an alternative. Kerry has commented, so we got 2 members of the stake. Thank you very much. Hi. Wave back at you. How long after tomato can you drive? Excellent. So let's leave it up there, Kerry, shall we? So in terms of driving, the first thing I would say is you need to check with your car insurance, because they might say it's got to be 3 weeks after surgery or something like that. They might say it's got to be a certain period of time, but they might say it's up to the doctor. So if it's up to me, we will see you at 1 week at the dressing clinic, and you're usually not able to drive to that dressing clinic appointment. You're able to be a passenger in the car because you're kind of bent when you're in the passenger seat, but I wouldn't say you'd be able to drive at that 1 week appointment because a tummy tuck is quite a big deal and it will knock you back and it is a bit uncomfortable. So 2 weeks, I would say, is possible after 2 weeks. So the first week you not feel like it, the second week you'd be feeling better, but not 100%. After 2 weeks, I think, is kind of when most people can think about going back to driving. If you drive because of work, sometimes I say to people, look, you're better off saying 3 weeks, because I can't guarantee the 2 weeks. And sometimes work can get a bit cheesed off if you say, I'm going to be back in 2 weeks, and then you're like, oh crikey, actually it's a bit worse than I thought. I'm not really feel comfortable for going back to work, things like that. So I would say 3 weeks is safer. For to be sure that you'll be able. I think most people will be able to drive at 3 weeks. Often you'll be able to drive at 2 weeks. So 2 to 3 weeks is the answer to that one, Kerry. And if you're employed, it might be safe to say 3 weeks off for that reason. Thank you for the comment. Second member of the snake, congrats. When can you start driving? And oh right, okay. When can you start driving and walking up the stairs after a tummy tuck? Okay, that's kind of like the same as the last question. Well, driving, can I refer you to the last one? Walking up the stairs. I mean, you're bent over, but you can walk up the stairs straight away. Most people have bedrooms upstairs, don't they? So you can go to bed. Yeah, you can walk upstairs straight away after a tummy tuck. You might need help. You obviously need a banister. You might need someone to support you for the first few days. But yeah, walking upstairs is fine. Just be a bit hunched over. See that? Mind your own business. My book, one of my books. That's my other one. It's my other book, by the way. Never accept to live from strangers. Yeah, sorry, that was similar to Kerry's question, wasn't it? What are the largest prostheses you have inserted on a patient, and up to what size do commercially available prostheses go in size? Well, I'll tell you now. That question right away makes me think I'm probably not your surgeon, because people asking that sort of question want big implants, and when I measure someone for implants, I go on the base width, and I don't really want to go more than the base width of your breast. Some people do, surgeons do put implants in bigger than the base width of the breast. So there are people out there who do put big implants in, but that's not me and that's not my practice. So I don't particularly do that. So I will have a go at answering the question, but I'm immediately thinking you're probably better off seeing someone else when you come and say what's the largest implant you've ever done, sort of thing. I don't know what the largest one I've ever done on, but it would be on a wide patient, because the wider it is, the bigger it is, and it would be 600 odd. Don't think I've ever done anything bigger than 600 odd. And what's the size do they commercially available go up to? It's kind of like that. I mean, they might make them 700 odd, I don't know, but 600 is, I think, usually the sort of biggest ones they do. As when you say commercially available, kind of off the shelf, so you can get a custom made prosthesis for these people who have these massive ones, 800, 1000, 1300 cc implants. You know, there are people out there with these big implants, but that would be a custom made implant. So the ones that are sort of stock, normally it's 600 odd. As I say, I'm not sure, because I don't go to that part of the implant range very often. They might be up to 700, I don't know. But as I say, it's mainly based on the base width of the implant, and then the shape and profile of the implant, and then that lends itself to a certain volume. So if you're one of those people who want the really biggest implants, or particularly if you've already got fairly big implants in and you want bigger implants in, then probably I'm not your surgeon. We've all got niches. I'm more into natural results, people who've had children, lost volume, asymmetries, proportion, bringing back into proportion type thing. That's kind of where I am with my practice. So big ones are usually not gonna. I can't make it look good, basically. So it's not really my forte, as it were. Okay, well, we had 3 spots on the snake, and we've only got 2 comments, but you know what's 2 comments and a little spot of the snakes. Okay, I'm not gonna cry about it. We'll work with what we got. Believe it or not, that is it for me. I got no more preordained questions. I promised to try and do a bit of practice before next week, and try and read the question beforehand, so I'm not left trying to answer a question I don't know the answer to. V and her VSG have a question here. Hi JJ, with implants, should they be upgraded, person changed every so many years? No. Good question, V and her VSG. If a lot of people think they've got to be changed every whatever, 10 years is the norm, isn't it? People say they've got to be changed every 10 years. No, most implants are actually built for life. They've often got a lifetime warranty. They're built for life. And the reason you need to have implants changed is usually your body's reaction to the implant rather than the implant itself. Obviously, the implant can rupture, but that's not as common as you might think. Probably the most common reason to change an implant is capsular contracture, which is scar tissue forming around the implant, making the implant go hard. And then you can have that scar tissue removed and new implants put in. Now, whenever you change implants, there are risks with changing implants. There are risks with the surgery. There's potential for complications. And so if you haven't got a problem with the implant, then I would say don't have it changed. We offer patients follow-up, so we do follow-up and keep an eye on you and what have you, but I don't particularly recommending someone have implants changed if they've got no problems and if they look fine, because you can potentially run into problems doing that surgery, and there's no need. If there's no clinical need to do that, I would say leave it alone and don't have them upgraded or anything like that. If there's no problems, leave them be. Now, good news, everyone. I've got great news. We've got another comment on Facebook, but sadly, just noticed, it's not sadly, I mean, I'm delighted we got another comment. It's from Sue, and because I think Sue did the first one, it hasn't added a little dot on the snake. So we still only got 2 dots on the snake, even though we've got 3 comments, but there you go. VSG, you're welcome. Adam, good to see you. I did see you at the Barbs, and I meant to say hello, and I didn't, and then I didn't see you again. But hello, Adam, how are you? Sue, just a quick one. Will my belly button close over if I can't stretch it? It's not unheard of, Sue. I mean, it's not common. I'll be honest with you. It's not common for it to completely close over, but it is potential. I don't want to worry you, Sue. But it is important to try and get in there and get massaging it. And if you can't get your finger in there, get something people often use like a back of a makeup brush. Get in there, get a bit of pressure to try and stretch it out and just try and stop that scar tissue from closing it down. So it is. As I said, I don't want to worry you. But since you asked the question, can it kind of close over? Well, yes, it can kind of close over. So you can't really get anything in, and it's like close. So that is the worry of a tummy tuck. It's always the worry is the belly button will be too small. I don't really worry about the belly button being too big. It's, you know, you can kind of close down a belly button if needs be, but often the problem is that it contracts in, and that is always a problem. So I would say to you, you know, get in there early, try and get some pressure in there, try and push on it to keep that scar soft, and over time, hopefully that scar will soften up and it will open up. But it's something we need to keep an eye on. So we need to keep our eyes on that one. So faux show, we're going to be keeping our eyes on that and making sure that it's all fine. I mean, you can don't despair, because you can kind of open it up if it does, and you can try and do surgery to widen and open up a belly button. It is quite difficult, full disclosure, to do that, because you have to kind of import tissue in, but it's not impossible. So it is possible to do that. So do not despair, but obviously prevention is better than cure. So if you can get a bit of pressure on it, get something in there, preferably your hand, then you will be in a better position. But don't worry, I'm going to hold you by the hand. Yeah, get you through this. Jude has got a question, and Jude is a new Facebook commenter, so we have now got our requisite 3 in the snakes. Jude, fantastic, well done for asking a question. I'm very grateful to you for said question. And what is that question? Well, I'll tell you what that question is. My breast implants are malpositioned and I want to go smaller. Can I get them replaced without a lift? Yes, for sure you can, Jude. Absolutely fine. The only problem is, and I guess it depends a little bit how long you've had them in, because the fact that you are asking about the lifting is that the implants will have stretched the skin a bit. If you haven't had them in for long, it might not matter too much, but if you have had them in for any period of time, that skin will be stretched. And so can you have them replaced without a lift? Yes, but there may be a shape compromise. Their shape might they might sit a bit low, they might droop a little bit. Okay, you've had them in for 4 years. So yeah, 4 years is a fair period of time. So that skin will have stretched in that time, and so the shape might not be as good, basically. So yes, you won't need a lift, but you might not have very good shape. It's difficult with, you know, without seeing you and examining you and seeing, because some people kind of need a lift already. So if you kind of need a lift already or borderline for a lift now, I'm not saying you are, because I don't know anything about your situation, but if you are, and then you downsize your implants, you're going to need a lift even more. So the shape will be worse. So it's just having a conversation with your surgeon and doing what's right for you. And if you don't want a lift, fine, don't have one, but accept the shape might not be quite so good, and they might be a bit droopy. And sometimes when you've got implants in, you can have kind of like an implant here in the breast drooping off the implant, kind of falling off the implant, which doesn't look great. And if you are, I mean, as I say, it depends on, it's hard to do this because I don't know anything about you, but if you are one of these people who's are worried about this, then on paper, if you don't want to lift, the way to get around that is to use a bigger implant to kind of take up the skin, take up the slack, if you like. But if you don't want a bigger implant, then obviously that'll make your breast bigger. So you might say, I don't want my breast to be bigger, I want them smaller. Okay, well, you can get the size right by having them smaller, but there might be a compromise on the shape. The shape might not be as good. So it's about going into surgery with expectation on what you could expect. So you don't go in and come out thinking, hold on a minute, they look worse. Because they might look worse, quite frankly, if they are smaller, because they might be a bit more droopy. Now, you might be happy with that because you don't want the size. You're happy having the smaller size, but yeah, expectation, that's the job we have as surgeons, to try and get our expectation on the same page, so you know what to expect, so you're not unhappy if the outcome is what we thought the outcome was going to be anyway, sort of thing. So good luck, Jude. I don't want to be negative, but just realistic. That's what it is. Be positive once you made the decision for surgery, but be realistic. Yes, if you're going smaller, they might be a bit more droopy than they are now. What we got? Ideally, I'm planning for bingo wing surgery and breast implants at the same time. What do you recommend as recovery time? I work from home. I think that is WFH. Office job, high pain threshold. Yeah, weapon. Hoping for 10 working days. Working days, 10 working days, quite a long time. Sounds good. V and her VSG. I like it. Because 10 working days is like, what's that? A week and a half, isn't it? I would have said 2 weeks. What did you say? I work from home. Yeah. Office job. The other thing I always kind of think to take into the mix, V, if you don't mind calling it V, is if you kind of work for someone else or if you work for yourself. So if you work for yourself or if you're kind of flexible, then you'll probably be going back to work sooner than if you work for someone else. And particularly if you have to go to an office, you've already said you're working from home. But if you have to go to an office, then you might want to have a bit longer off, because you don't want to go back to the office and then think, oh, I feel really tired, I feel really uncomfortable, I want to go home early. And everyone says, why did she come back? Why didn't she take more time off? So, you're probably 3 weeks before you're into things a bit more, a bit more active and what have you. But I understand we all need to earn the filthy lucre. So we all need to go back to work at a certain time. And I think 10 working days is not a bad a length of time. And I think you will feel a lot better in that second week. I think the first week you will be uncomfortable. It's quite a lot. So what you're doing, bingo wings and breast implants, yeah, it's quite a lot of surgery. We'll feel quite tight, quite uncomfortable. But I think 10 working days is a reasonable goal. It's always difficult, isn't it? Because you don't know. Some people feel great, some people feel uncomfortable. Hopefully you're going to be one of the great ones. But I think that's reasonable to say. But also talk to your surgeon, as I say, we'll see what they say. But this surgeon here says that sounds reasonable. So, well, I'm going to go and get this in the wash. Hold on. Oh, it's not pen. Oh, wait a minute. Oh, it's my scarf. Oh, it's not pen at all. It's my scarf. I thought it was pen marks. Thank goodness for that. I thought it was... Got a bit of a cough, haven't I? That's good.